It can be exhausting to navigate life when isolated, facing one stressor after another, exploring who we want to be, or trying to recover from a traumatic experience. Now more than ever, people are reevaluating their priorities and trying to cope with the relentless stress and grief of the last few years. Sometimes people feel stuck when a major life event happens, and this can cause a lot of turmoil too. For many, these experiences interfere with day-to-day life, in our relationships, at work, home, school, and more. But you can find your way through. Hi, I'm Elizabeth Pugliese. I'm a licensed clinical mental health counselor and addiction specialist associate here at Matthews Counseling. Therapy should be a place that is free of judgment or shame, and a space where you can explore how you want to grow as a person in an authentic way. It's also a place where I believe you have the tools needed to live the life you want, and you have the answers to overcome the many challenges that life brings. My job as a therapist is to guide and support you along the way, help draw out insights from within, and sometimes challenge you to confront things you may be avoiding or help reach your goals. That being said, the most important part of therapy and the biggest sign of success will be the relationship between you and your therapist. This is one reason I approach therapy by getting to know you as a whole person, including your environment, your resources, supports, and understanding your day-to-day life. People are so much more than a diagnosis or symptoms they have. I use a collaborative approach to help empower your strengths and support you along the way. I also work with you at the end of each session to come up with some type of action plan you can take home so you can apply what we do in session to your life outside. A lot of the work in therapy occurs outside of the session, and some days are harder than others. This is completely normal and totally expected in most cases. Like life, therapy also has its ups and downs, and healing can look different for everyone. This is because sometimes we discover more about ourselves in therapy or confront things we've been avoiding, and this can cause discomfort and strong emotions. But with proper support, we can prepare for this and build coping skills to make this process feel safe. If you feel unfulfilled, unsure how to navigate change, or you want your health and well-being to improve, I'm here to support you as you move toward who you want to be. After all, nothing changes unless something changes. On a personal note, I got into this field because while I love learning about mental health and why humans are the way we are, my true passion is working with people and getting to know others on a personal level. I work with all individuals from all backgrounds, and I'm LGBTQ+ affirming. I work with those who've experienced trauma, substance abuse, grief, depression, anxiety, and difficulty managing emotions in relationships. In my spare time, I love the warm weather and being outside, walking with my partner and dog, hiking, swimming, and cooking and eating. I would like to work with you and support you reaching your goals and living the life you want. If you think you want to try therapy or get back into it, reach out to our office to schedule your first appointment. To begin this process, you can request an appointment with me online at matthewscounseling.net or by calling the office at 919-587-8018.